Are you tired of your patients coming back to the clinic with reports that their imatinib treatment for chronic myeloid leukemia just isn't working? Consider prescribing Dasatinib, sold under the brand name Sprycel. Dasatinib shows an increased affinity for the active site of the Abl kinase domain on the Philadelphia chromosome, which results from a reciprocal translocation between chromosomes 9 and 22. This drug more specifically targets the BCR-ABL tyrosine kinase, even in patients who have developed a resistance to other chemotherapy treatments like imatinib. This mechanism prevents the tyrosine kinase from binding to ATP and transferring a phosphate group to tyrosine. Although rare, receptor tyrosine kinases are important for various cell activities and often contribute to the progression of chronic myeloid leukemia. Ultimately, this drug serves as a receptor tyrosine kinase inhibitor, lowers the number of blast cells in the blood count, and effectively treats chronic myeloid leukemia. In randomized clinical trials against imatinib, 77% of patients on Dasatinib achieved complete cytogenetic response at 1 year, meaning the number of Philadelphia chromosomes in the body significantly decreased. In this same trial, only 66% of patients on imatinib achieved complete cytogenetic response. Furthermore, 52% of patients on Dasatinib experienced major molecular response in their first year, compared to only 34% on imatinib. A major molecular response in patients corresponds to a low count of the BCR-ABL protein, the very tyrosine kinase that leads to CML in the first place. This drug presents favorable outcomes in long-term randomized trials as well. After 5 years, 83% of patients achieved complete cytogenetic response compared to only 79% on imatinib. Additionally, 76% of patients underwent major molecular response, while only 64% of imatinib patients saw this same benefit. While the outcomes of this drug are promising, a few potential side effects must be closely monitored if you decide Dasatinib is right for your patient. Myelosuppression can be common with Dasatinib treatment, and complete blood counts should be taken at least every other week for the first 3 months of treatment. About 6% of patients in the randomized study experienced grade 3 to 4 hemorrhage, at which point a transfusion may be required. Fluid retention is also experienced in 5% of patients, so pay close attention to signs of pleural effusion or dyspnea. In spite of these side effects, the potential benefits your patients will experience from Dasatinib are endless. Particularly if they are not responding to imatinib treatment, give Dasatinib a try. Your patients want an answer to their chronic myeloid leukemia. Dasatinib is that answer.